I've got someone impatient over here. Say hi, little Elsie. She lost her eye. It was a freak accident with a motorcycle. She's so sweet though, huh, Elsie? She's such a good girl. She's a mama's girl. She's my therapy dog. She stayed with me pretty much the whole time I was recovering from surgery. Well, so anyways, after I was the book that they give you at Dr. Shatkins for their mini dental implant options. His name is Dr. Todd Shatkins from the Aesthetic Associate Center in Amherst, New York. When you open this, it says they have 3 great options. 1, 2, 3. I'm just going to start with the one I got. It's called removable acrylic overdenture. That's how it looks. And then they have the price broke down here for the lowers versus the uppers. It tells you what the payments would be monthly. They work with different finance companies. They got us financing through 2 different ones pretty much. So I think one covers the upper, one's the lower. So it tells you how much in total. The procedure for the lowers is $7,200 and $9,600 for the top. So it'd be $239 a month for the top, $179 a month for the lower, or a total. So he charged me $16,000, like even. Said he didn't charge me for the extractions, probably because I told him I probably wouldn't be able to do extractions there unless I was put to sleep. And he could put me to sleep, but because I've woken up during sedation, I woke up during my breast augmentation. I woke up last time I had extractions done with sedation. And it's like when you wake up and you can't move, but you can feel stuff and all that. So it's pretty terrifying. He said he'd rather just keep me awake and comfortable. So he took the cost of the extractions right off. That was nice. So I got this removable acrylic overdenture. It's on six implants on top, 4 on the bottom. Says it's the most economical way to manage loose dentures, or you can use this method with dentures that already exist if they're able to put the attachments down there. Involves placement of between 4 to 8 implants determined by bone volume and bone quality. Price, it says, does not include extractions, bone grafting, or temporary teeth. Price, it says, does not include extractions, bone grafting, or temporary teeth. 0% financing options also available. So anyways, I was charged $16,000 even, and right now I'm paying off 2 different loans, so I get one bill for the uppers and one bill for the lowers, so it splits my payments up into 2 different ones. So I have a bigger one of like $230 something, and then the other one's lower, like $130 a month. And then their next option here is a semi-removable option, like this. It's made of hybrid resin or zirconia, called Fix on 6. And then the price of this one, you just have to think that's not the total for both top and bottom. That's the price of either the uppers or the lowers, because the total procedure cost on that one is $15,700. Pretty much times it by 2, so it'd be about $30,000. So this one I think doesn't really have so much of that acrylic for your gums, if that's what it is, acrylic. I don't know. I'm no expert. But it looks like mostly just the teeth, and this is semi-removable. So I think this is the one that the dentist would remove when you go into the office. And then they have the last option is a non-removable permanent zirconia bridge called the Roundhouse. And this one is $439 a month, but so it would be about twice that, I'm assuming, because procedure fee is $17,700. But it's like $35,000 total. He told me that. So these are like cemented in, they don't come out. The nice thing about, and this one says, involves a placement of between 10 to 12 implants. Final bridge is tried in for the patient comfort and aesthetic approval and then cemented in place. It's a cemented zirconia bridge. So the nice thing about getting the mini implants of any kind is that you can upgrade later. Like he can, like if you have regular dentures only and get the implant, sometimes they can customize your dentures to go on the implants to secure them so they don't move anymore. And so you don't need the top plate on top. Like I just have horseshoe shapes on top and bottom. No suction palate or whatever. And then if I want to make these permanent or semi-permanent later, he said that process is pretty easy. They can use the same teeth. So there's a lot of options, but those are the options, and that was the price. I paid $16,000. And I don't have the final product yet, but you guys at least are, now you know where I'm at in the process and what I've paid so far. General idea of what the monthly payments would be if you financed it, and that's about it. I'm gonna go enjoy my kids' softball game. Thank you all for watching. One more thing, there's a Facebook group I found. I think it was the before and after denture support group maybe, but there's a women's one and some other ones. I'm pretty new. I haven't found them all, but one of them has some files, and one of the files is pictures of smiles in different shapes of teeth. And then it also tells you like the personality or character traits of that smile, or how people perceive that smile. So you can literally look at the picture and pick what smile you like, and if that's how you want to emanate. But it's cool. You can pick all the shapes and everything. I think that's pretty freaking cool. I never knew that. So maybe with the permanent ones, maybe I'll actually have the chance to have some considerations made in regards to shape or whatever. Like, you know, that one tooth that looks pointier, I could say gives me character, because my real teeth, or my teeth before extractions, when I had my 2 bridges cemented in and I had a partial, the smile from this direction always looked a little different anyway than the other side. Like when I was a baby, I split one of my adult teeth all the way up the roots, so it only grew in like small. So back in the day, I had an uneven smile, like up until I was 18, 19 or 20. My smile's never been perfectly symmetrical. I'm almost used to it being off a little bit, but we'll see how much that changes when I think that is about it. Anyway, so thank you guys for watching. Make sure that you subscribe if you want to follow my next updates. Like I said, I might do some updates about my breast augmentation. I'd probably just do them on this channel. I might just call it Glitterhead Diaries or something, but I haven't really decided. I haven't thought that far. So let me know if you're interested, if there's anyone who would be interested in seeing videos about my breast augmentation, even though I started this channel for my dental things. But since my doctors are both in the same building in the same practice, I don't know, I could do that. It's something I've been thinking about. I just don't know how. I don't know, I haven't thought about it enough, so we'll see what you guys think. Other than that, thank you all for watching. Subscribe, don't forget to subscribe. Ask me anything that you're interested in. I'll try to answer your questions, and if you have any ideas or requests for videos and what you'd like to see me do, let me know, and I'll put it in my little journal on my list of things to not forget. But thank you guys for watching.